Well, good morning, everyone. And once again, welcome to another live this morning and soon to be podcast. Always great. My privilege to do this. Sandy and John and Stephanie, Denise, Len and Judy, you guys are great. Thanks for coming on this morning. We appreciate it. Nativity. Big crowds. I think yesterday we went to 7,000 or 8,000 shared, and so we appreciate it. Beth and Madeline, good morning to you. Andrea, Jerry from Nouveau Brunswick, Dave, you guys are great. Sherry, Susan, and our staff, Jeanette, watching this morning. Connie, good morning to you. You guys are great. I mean that. Nothing would be possible without you guys. Anita from Ireland. Well, top of the morning to you. Good to have you on with us this morning. Deb and Terry. Okay. Ready to get going. Rebecca, good morning from Calendar. And Jeanette and Nellie, Kim. Hey, you guys are my favorite people in all the world. Joss, good morning. Sturgeon Falls, Yolande. See, Yolande, I waited for you. Bruno, Pauline, you guys are great. Okay, so around the globe, watching and participating on a daily basis. We sure appreciate it. Good morning, Shirley and another Sharon, and you guys are great. I'll come on afterwards and say hi to you. Guys, now, I hope you get our emails, okay? I hope you get our emails. I want to dig in a little bit on the next couple of podcasts on the email that we sent out this morning, okay? So if you don't get that email, okay, make sure you signed up for the email because we do some great teaching in the email. So if you don't get that, I'm going to explain that email this morning, okay? And maybe for a couple of days because I take this. It's almost like the world is asleep. We have in North America, okay, in Canada and the United States, I can't speak for the rest of the world. We have a huge, huge problem in North America. And we're burying it. We don't talk about it. The news, the media, even social media, rarely talk about it. And it is what we've said in the past, the elephant in the room. And it's incredible because it's the most pressing problem in our society today. The number one issue is not the climate. I beg to disagree. Okay? I beg to disagree. Because it's not the number one issue. The virus is not the number one issue. It seems like it because all the emphasis is, and I've complained about this in the past, that I appeal to my doctor friends. Why are we allowing medicine to be hijacked by public health officials? Again, I'm not talking about their motive. If I was trained in virology and I was the head of the health unit or whatever in my city or whatever, of course you're focused on a virus. But I appeal to all of medicine. There's an elephant in the room. You're missing it. This is the catastrophe of all catastrophes in medicine. Again, I come to the point that, not coming from my statistics, although I think it's worse than this, but these are not my statistics. 88% of the population in North America is unwell. 88% of the population in North America is unwell. Metabolically. Meaning there's 12%. And you guys might be part of that 12%. I hope you are. I hope you are. And I'll talk about that. How to know if you're in that 12%. Of those watching, listening, how do you know? Your body gives you clues as to whether you're healthy or not. You've got to learn to listen. You know, listen, Linda, listen. Your body will give you clues. 88%, and I think it's over 90. This is just me. It's my impression that it's over 90% of the population is unwell metabolically. They're on their way to catastrophe. You know, I don't even know. I think it was Al Gore or somebody said it the other day. We got 9 years left for the planet. I don't know how he comes to that, but it doesn't matter. He said it, and I don't know. I don't agree with him, but it's not my area of expertise. I got to tell you that, but I don't see it. Okay, I don't see it, and I'm not that concerned about it. I mean, the planet is going to self-destruct in 9 years because of the climate, because of carbon fuels and our carbon footprint. I don't know. I don't think so. I'm not relying on Al Gore. You know, I'm not staying up at night because of that. But I'm going to tell you something, guys. Where the planet is self-destructing, especially in the northern North American hemisphere, is our bodies are self-destructing. 100%. It's 88% according to the CDC. And I believe it's over 90%. People are unwell. Not from a virus, but from metabolically. And let me tell you this. Let me tell you this. The number one thing, read that email. The number one thing is insulin. Insulin resistance or high circulating insulin. The Martin Clinic, we like high circulating insulin. High circulating insulin doesn't mean high circulating blood sugar. So you don't wait till your blood sugar is too high to do something. That is what Tony Jr. calls a lagging indicator. Don't wait for your blood sugar. I am going to go over some things this morning to remind you that your body is screaming. Some people, their bodies, hello, hey, you there, pay attention, I'm trying to get, sometimes it screams, sometimes it's mild. But when your body starts talking to you, you must listen. You must listen. I want to go over that. Why? Why? Well, let me give you the study in the email. The study in the email, brand new study, came out from the Lancet Diabetes and Endocrinology. When you know what endocrinology is? You know what your endocrine system is? It's your hormones. This afternoon, I'm going to teach a course on Hormones 101. Hormones, ladies. Okay? I'm going to teach that course at the University of Tennessee, thanks to the good friend of the Martin Clinic, Dr. McEwen. She's asked me to come in and, go over with her psychology students some basics. I'm happy to do it. You know what? I don't care how old you are. I want to teach. I want to show you something. I don't think it's that complicated. I want to make it simple so that people understand. It says, in this study, it says in the Lancet Diabetes and Endocrinology, cancer, listen to what I'm going to say, cancer overtakes vascular disease. This is the headline. Cancer overtakes vascular disease as the leading cause of excess death in diabetics. Now, let me unpack that for you a little bit. Cancer overtakes vascular disease, heart disease, stroke. Okay? Cancer overtakes that as the leading cause of death in diabetics. Now, diabetes, not type 1, type 2. Type 2 diabetes. Adult onset diabetes happens in children too. Is the biggest scourge in our society today. Because it is at the root of all metabolic disease. If a person is a diabetic, they have a food problem. It's very specific too. They don't have trouble with steak. They have trouble with bread. It's carbs. You have an allergy to carbs. I've said that many, many times on this program. But way before, remember, blood sugar, not insulin. Blood sugar is the last thing that happens. When your blood sugar goes out of control, it's the last thing. It's not the first thing. The first thing is your insulin. You know the illustration I've used? The bad neighbor. A big pain. They're always at your house. They bug you. Guys, that's insulin. Because we're carbaholics. Put your hand up. My name is Tony and I'm a carbaholic. I am a carbaholic. I gotta tell you that. I don't live on carbs. I don't eat a lot of carbs. I don't. I can't. But, if you're an alcoholic, you're an addict. And it just goes into remission if you stop drinking. And if you go to AA meetings, they'll tell you, well, you can't drink anymore. You know why? Because you're only in remission. Diabetes, I can fix in 30 days. 100%. Why? It's a food problem. It's the number one problem in the world when it comes to destroying the world. It's the number one problem. And it's food. This study is saying, okay, cancer. Because listen, diabetic, if you know anybody that's a diabetic, here's what a diabetic is worried about. Their eyes, their kidneys, their heart. They know that automatically because a diabetic has the first thing that sugar destroys is your little blood vessels, your capillaries. Your capillaries are just little attachments between your veins and your arteries. Little capillaries, they're so tiny. I like looking at capillaries when I go into and I look in a person's eye and I see all those little highways and the 401 and the 407 and the Don Valley parking lot and all those things. It reminds me of my days living in Toronto with the major highways that are always busy. But when I go into somebody's eye and I look in the back, I go, well, look at all those highways. I'm looking at capillaries. Blood vessels. And when you have sugar that's left in your bloodstream, it destroys those rapidly. That's why kidneys don't work. It's circulation. That's why diabetics have so much trouble with their kidneys. That's why diabetics have so much trouble with their feet. Diabetic retinopathy. Neuropathy and retinopathy in the eyes and cataracts. You got cataracts? You're a sugarholic. And they're saying, not that they don't have trouble with circulation, they do. But they're saying now the worst thing in terms of death is not even the heart, even though that's terrible. Because diabetics are 50 times more likely to die of a heart attack. They are 10 times more likely to be Alzheimer's because of this in circulation to the brain, of having amputations in their legs. And if you're diabetic, you're on your way to dialysis. Your kidneys eventually not going to work. That's all circulation. But this study is saying, but cancer in diabetics has taken over the cause of death. Does that surprise me? Yeah, maybe a little bit. But understand what insulin is, guys. It's a growth hormone. It makes things grow, grow, grow. It makes things grow. And so it makes cancer grow. So that's sort of the foundation I want to give you. If you understand that it's food you can't control, I don't know. You know, you can't control everything in the environment. You know, I've told you that a million times. You know, where are you going to go? To Mars? I saw a picture of Mars the other day. You know, I guess, I don't know if it was an American one or whatever. We got pictures coming back from Mars, and I was looking at it, and it looked probably like the Sudbury used to look about 50 years ago. Like just rock. Red sand and rock. And I said, well, you know, I'm pushing 70. I don't think I'm going to make it to Mars to escape planet Earth. You? Some people think they're going to live forever and they're going to, you know, I'm just going to leave this planet and go to Mars. Well, good luck with that one. Maybe man will live on Mars someday. I don't know. All I know is I'm on planet Earth, and the biggest problem on planet Earth is food. It's food. And isn't it interesting that the elephant in the room is a food problem? Because diabetes, forget the diagnosis of diabetes. 88% of the population, when they say metabolic syndrome, 88%, CDC. You know what that means? 88% of the population is really diabetes without the diagnosis. Don't wait for the diagnosis. Oh, doc, I'm a diabetic. Okay. I used to tell patients when they come into the office, and I would do all their blood work and all that, and I'd grab their little face, and I would say, listen to me. You are on the Titanic. Do you understand that? Everybody knows the story of the Titanic. Even kids know the story of the Titanic. And I said, you are on the Titanic. You have metabolic syndrome. And they probably didn't even know what that meant. But I would say to them, listen, you have an insulin problem because that is the cause of all metabolic disease. It's insulin. It's a hormone. And you only use insulin when you eat. You guys know that. But I have to reinforce it. Because when you read the news, when you see the news, the media never, ever, ever talks about the right thing. What will kill our economy is disease. It's metabolic syndrome. Yeah, there's other things, but this is the big one. It's the elephant in the room, guys. And I know I'm preaching to the choir, and maybe some of you new folks, you know, we have new people coming on every day. We appreciate that. If you want, go back and listen to our podcast. Oh, Dr. Martin, you're like a one-trick pony. I know. I do the same trick all the time. But guys, it's at the root. When I see a study like this that came out of Lancet, it's why we wanted to write about it in an email. It is so flabbergasting for me that people are just not getting it. Doctors don't get it. They don't get it. Doctors are so worried about when you get sick, but not preventing your sickness. Let's wait Oh, okay. Oh, now you have diabetes. Let's give you medication to control it, to manage it. You have cancer. Here's what we're going to do. Let me come up with a plan. Chemo, radiation, surgery. Chemo, radiation, surgery. Nothing's changed. And now they're doing, I like it, they're cancer therapy. They're looking at immunotherapy now. I like that. They're thinking outside the box. But guys, basically, why wait till we're sick? I want you to listen to your body. It will give you clues. Your body gives you clues. Sometimes it screams. Sometimes it just gives you a little kick. Sometimes it's a small, still voice. But you need to listen to that. Guys, listen to me. Are you tired? I wrote a book years ago, Energy Robbers and the Fatigue Cure. Number one reason that people visit their physician, at least this was a couple of years ago. Whether it's still true today, I haven't seen the most recent statistic, but the number one reason that people go to their doctor is fatigue. Number one. Can I say something? If your body's tired, the number one indicator, the number one reason, yeah, it may be your thyroid. Your thyroid is your metabolism. Your thyroid is your gas pedal. Your thyroid, I get it. But that is an organ. It's a puppet. The thyroid doesn't work on its own. The thyroid gets all of its from headquarters. Guys, the vast majority of the problems with low energy is insulin. It changes your hormones. Ladies, it's the number one reason that you're tired. You might think it's your thyroid. Yes, your thyroid's involved in that. But it doesn't come from the thyroid. Even your thyroid, hypothyroid or hyperthyroid problems that medication is meant to manage doesn't come from the thyroid originally. Comes from insulin. It comes from food, the food hormone. Your body reacts when you're eating the wrong food. It creates an inflammation response. Your body wasn't meant to eat that many carbohydrates. Your body wasn't never meant for it. So your body will start screaming. Number one symptom that you are metabolically unwell is fatigue. You know what the number two one is? Pain. Pain. I proved that. In all the studies that I did, in all the clinical studies that I did with patients, it's always live, hands-on. I didn't use laboratory mice. My patients were my laboratory rats. I never called them that, by the way. No, but, inflammation, pain, unexplained for a lot of, I'm sore, doc. Your body's telling you something. Now, if you went out and played baseball and you're not used to it and you went to the gym, that's why the gyms are full in January and empty in February. Oh, I didn't know it was going to hurt. Yeah, it hurts. You haven't used it, use it or lose it, and you're stiff and sore. Get to my age and see what happens. I'm trying to stay in good shape. I try, guys, okay? I mean it. I try and stay strong and flexible. Look, I'm the stiffest guy you've ever met as me. I think it was our genetic, just stiff. But I'm always trying to stay strong so that, I understand the importance of that. But guys, when you have symptoms that are sort of now become chronic, like I'm tired, I'm not at the top of my game, I'm dragging my, as we used to say, dragging my butt, I'm sore. You see, everybody's different, guys, and I'm giving you some indicators of general. I'm going to surprise you with some of these. What? That is an indication of insulin? Yep. It's an indication that you used your pancreas too much. You secreted too much insulin, you created a bad neighbor, and your cells don't like it anymore. And for some, it's fatigue. That's the number one. I mean, it affects you, your quality of life. Your body's smart. It will react. Like Tony Jr. always says, you don't go to bed healthy one night and you're sick the next. Well, you could with a virus. You get a bug. Happens like this, right? Now, it was going on for a bit, but you didn't notice it at all. Then all of a sudden, I feel like I got a bug coming. Well, that's a bug. That's different. But generally in anything in your metabolic system, you don't go to bed, on Friday night, you're healthy as a horse, and Saturday morning you wake up and, jeepers, I don't feel good and I got cancer. It doesn't happen like that. Along that trail, before you get to cancer, your body was telling you something. Along that trail before heart disease, your body was telling you something. See, I'm a history guy. I used to shock people in my office with the amount of history I was interested in. I liked history in high school. I liked world history. But I'm very, very interested in people's history, patients' history. My dad used to say, listen to your patients. They have inside information. They have a story to tell. Doctors today, and this is just a general statement, they don't listen. They're married to the lab. Oh, you're not a diabetic. Nothing to worry about. Don't get married to the lab. I'm not saying the lab's no good. I'm not saying the lab's no good. I've got a few things I look for in the lab. Don't send me 17 pages. I don't care if you do. But you have to understand, I'm looking for a few things. I'm not looking for 1,000 things. I don't need to. Okay. Tomorrow we continue. I want to go on a deep dive. So that even when you know your family, you know your friends, Now, you might not even be able to talk to them about it, but at least you'll know, you know what? They got a problem. They don't see it. And you can bring a horse to water, but you can't make them drink it. But you can put a little bit of salt in their oats. Don't eat oats. See? Who gets the oats? The horse does. No, just to make them more interested in their health. Guys, this is such a big thing in society today, and we're not talking about it. Here we are, we've been a year on this virus, and nobody's talking about metabolic syndrome. Or very few. Okay. So tomorrow, more clues. I'm going to give you clues. We talked about just a couple today. Fatigue and pain. Like I said, someone kicks you in the knee, okay. But you waking up with pain all the time? Tendinitis? Chronic? Anything with an itis at the end of it. Tinnitus? Doc, what's tinnitus? Buzzing in your ear? Why do I get that? Your insulin's too high. Yep. 99% of the time, that's the cause of it, tinnitus. Bzzz in your ear. Your body's saying, hello, you there? You're not listening. I'm trying to tell you something. You are fearfully and wonderfully made. Psalm 139. Your body's smart, it will talk to you. But if you don't listen, let me end with this, men. I love you guys too. But men, we are so stubborn. You have no idea how many thousands of men I've seen in the office. Men are dense, man. They come in, what's the matter? Nothing. Why are you here? My wife. How are you feeling? Good. That's men. They don't want to listen. I'm an exception. That's my wife. Men, aren't we something, eh, ladies? Oh boy, stubborn. It's true. Men, no, nothing's wrong, nothing ever. Oh, ladies, you guys are tough living with us guys. I mean it. Okay, let's talk tomorrow, okay? Have a great day.